Hello, everybody. Welcome to today's webinar. My name is Alec Cooley, and I am a senior advisor here with Busch Systems, and I do all these programs and other best practice resources that we create for folks like yourself who are running programs locally and involved with helping keep recycling and waste reduction going. So today's program is entitled Targeting Hard to Recover Waste in Healthcare. This is one of a series of roughly every month or so webinars that we do that are all oriented towards waste reduction for different sectors. We've done recent ones for K through 12, venues, hotels, and healthcare. Healthcare is today's theme. We will be doing another one next in January as well, targeting to composting organics, food organics, and we'll share more about that later in the presentation. So for in a moment, I'm going to make a basic introduction to what today's program is about. But I do want to point out that at the very end of the program today, for those who are interested, we will have some associates, colleagues from our sales team will be doing a product demonstration for those who are interested to learn about the bin products that Busch Systems creates. But that is separate from today's program and will be at the very end for those who choose to stay on. Great, so let me briefly introduce today's panel. I'll be joined by Kyle Dennison Martin, who is an adjunct assistant professor of emergency medicine with the Warren Albert Medical School of Brown University. Then we have Glenn Goodsale, who is the recycling manager with the Mayo Clinic in Rochester, Minnesota. And then we're joined by Mary Ann Dawson, who is a sustainability consultant, and Sonia Janasek, environmental sustainability manager, both of whom work with a group of different health facilities in British Columbia. And they'll introduce more about where the facilities they work with. And finally, we're joined by Margie Wood, who is a registered nurse and works in an operating room environment with Littleton Adventist Hospital. And she'll be sharing some of her perspective as well. So this is today's program. Obviously, we have everybody muted, all the attendees muted, just to keep down background noise. But to the extent that we can, we want to make this as interactive as possible. We know a lot of you have a lot of your own experience, lessons learned, and to the extent we can, we would love to share that and make this as an interactive program. So. There are two different ways that you can do this. I think most folks are familiar with Zoom at this point, but what I would ask is that use the Q&A function in your toolbar specifically for questions that you want panelists to respond to. I will, when I see those coming in, I'll curate and I'll vocalize those as we're able to. We will, for the most part, we'll take one or two questions after each presentation, but we'll save the majority for the second half of the program when we go into more of the panel. Separately, I do encourage folks just to add notes into the chat. So separate function, but if there are things that we're talking about that you have your own insights, your own experience, observations you want to share, I strongly encourage folks to share those. Just be sure to put those into the chat function. Help us keep separate what we're introducing to the whole audience versus just the written discussion. And you can submit your questions at any point during the program. And again, I'll bring those up as we're able to. So let me start off just to set the stage. Anyone who has spent time in a patient care setting has observed the large quantity of single-use items and packaging that are generated and in most cases disposed of in the trash in healthcare. What we see as patients or visitors is mirrored behind the scenes in the operating room and other procedural areas as well. All that waste has a significant environmental impact. In the US alone, the healthcare sector is estimated to generate 2 billion tons of waste annually. And that adds up by their estimates to about roughly 10% of the waste-related greenhouse gas emissions that are generated in the US. That's a huge impact. There have been broad efforts across different sectors in recent decades, not only to recover, but also looking for ways to prevent some of that generation of unnecessary waste in institutional settings. So while this has been slow going for other sectors like corporate offices, universities, government agencies, it's been especially difficult to make headway in the healthcare setting. As we'll discuss today, regulations, economics, a risk-averse culture, and of course, basic health concerns are all some of the barriers that sustainability initiatives face as we try to address the flood of single-use items that are discarded. The question is, where can we look to navigate between those to find real progress and make a dent? And a lot of effort has been going into this in the last 10 years, and we're starting to see some real progress. Obviously, it's still a hard road that we're traveling, but our panelists today are going to be sharing some of the examples of what they're doing at their facilities, some of the insights, lessons that they've learned. And again, as I said, we would love to share your experience as well as we go through the program through the chat function. We'll begin the program with a brief presentation from each of the panelists. Kyle Martin will start off sharing insights from a waste composition study that he co-authored, analyzing the waste generation and disposal patterns from a local hospital emergency department. Then we'll have Glenn Goodsale, Marianne Dawson, and Sonia Janasek, who will each follow with a brief case study overview of what they're doing at the facilities where they work. And then lastly, we have Margie Wood is going to make a quick introduction to her hospital and what her role is as an OR nurse, and as well as a chair of her hospital sustainability committee. That'll be roughly half the program, and then at the when we finish that up, we will shift into a panel discussion, and we'll save a good, we're hoping to have about 35 to 40 minutes set aside just for the discussion, which will be more of a back and forth. So with that, let's go ahead and just jump right in. And I will make the introduction to Kyle Martin. And Kyle, I'm going to give you control of the cursor, and you can take it away from there.
Great. Hi, everybody. I'm Dr. Kyle Denison Martin from Brown University. Today, I'm going to be talking about two different waste audits that were done in New England, in the US, and some takeaways that we have from those different waste audits that were conducted. So the objectives of my presentation, my brief presentation, are to become familiar with the waste audits that were conducted at the two different facilities in New England, and then to know the three takeaways from these audits that can lower costs as well as reduce the environmental impact from emergency department waste. So I'm an emergency department physician as well as an academic faculty member right now at Kent Hospital in Warwick, Rhode Island. But I also work at Brown University. I work on climate change and planetary health research, but I will also work in global emergency medicine. As a background for this presentation, we're going to be talking about two different waste audits that were conducted in the New England region of the US. One was at Kent Hospital. Kent Hospital is a suburban community hospital in Rhode Island that has about 70,000 annual ED visits. And then we're going to be talking about takeaways from a waste audit at Mass General Hospital, which is an urban tertiary care hospital in Massachusetts, with approximately 110,000 annual ED visits. And the waste audits that were conducted in 2020 and 2019, both before the COVID pandemic began. During these waste audits, all waste was collected from the emergency department for a 24-hour period. And this included regulated medical waste. Regulated medical waste was defined according to state standards. And this included items that were placed into red biohazard bags, as well as sharps containers. It also included municipal solid waste. And this was sorted into different categories, including hard plastic, soft plastic, paper products, food waste, textiles, glass, metal, electronic waste, and unused items / mixed materials. So now we're just going to go into the brief takeaways from the waste audits that were conducted at Kent Hospital and Mass General. Takeaway number one is that inappropriate disposal of regulated medical waste is expensive, efficient, and environmentally impactful. And this was particularly the case looking at the waste audit at Mass General Hospital. Comparing the two different waste audits, the waste that was generated per patient encounter was similar, but the estimated carbon emissions from waste was 10 times higher at Mass General than it was at Kent. And this was driven by regulated medical waste. So only 15% of waste that was disposed of in red bags and sharps containers, or in other words, regulated medical waste containers, met criteria for regulated medical waste. And regulated medical waste costs about 5 to 10 times as much as municipal solid waste to dispose of. And because of specific requirements for the disposal of regulated medical waste, it leads to higher carbon emissions as well. So regulated medical waste accounted for 70% of the carbon emissions at Mass General Hospital. And like I said, and that 10 times higher emissions versus Kent. Takeaway number 2 is that ED waste is filled with unused medical items. So this was a problem at both Kent and Mass General Hospital. Unused medical items found their way into the waste stream. So at Kent, more than 170 unused medical items, constituting 5.2% of the overall waste, were unused medical items. And at Mass General was the same problem, 201 unused items, including 76 bundled and unused tourniquets. Particularly notable is that there were a lot of unused resuscitation supplies in both of the waste audits that were conducted. This slide gives an idea of roughly some of the items that were included in the Kent waste audit. And I'm just going to play a short video that gives an idea of just the sheer number of unused supplies. All of those items on the table were found in the waste audit that was conducted at Kent in the emergency department. And all of those were completely unused items. And this is a table that includes some of the items that were found, the unused items that were included, including some medical items like lorazepam, bags of unopened or unused IV antibiotics, unused IV fluids, and all sorts of resuscitation supplies like suction materials. There was a seat collar. And one thing we'll talk about a little bit later, I'm sure in the panel discussion, is unused food items that were given to patients. Takeaway number 3, how and where waste is disposed matters, and to consider in-house sterilization of reusable supplies. So what we found with the waste audits is that hospitals, including Kent and MGH, have a tendency to dispose of their waste thousands of miles away. And that might be for processing of regulated medical waste or just disposal altogether. And whenever possible, conducting in-house sterilization, particularly of reusable supplies, can really cut down on cost as well as environmental impacts. And one of the things that I wanted to highlight is trying, particularly in the emergency department's setting, to emphasize reusable procedure kits that can be sterilized in-house and then restocked in your emergency department, and working with staff in order to figure out what items should be put in those kits. The other thing that I would emphasize is trying to reuse personal protective equipment. So you can reuse both N95 masks, and then we have cloth gowns that can be reused in the emergency department setting. So just to summarize our 3 different takeaways: 1, appropriate disposal of regulated medical waste can really cut down on costs, and it can cut down on the environmental impacts of waste in the emergency department setting. So trying to keep municipal solid waste out of the regulated medical waste stream. 2, ED waste is filled with unused items. So making any sort of intervention to try to educate ED staff on the fact that unused items are present in the waste stream, and crafting interventions to try to prevent unused items, particularly resuscitation supplies, from ending up in the waste stream. And that will, again, cut down on costs, and it will reduce the environmental footprint. Finally, the last one, how and where waste is disposed of matters, and consider in-house sterilization of reusable supplies. In the ED, that means procedure kits for laceration repairs and incision and drainage, but it also means trying to sterilize and reuse personal protective equipment, which can include masks as well as cloth gowns. And with that, I'm wrapped up.
Great, thank you, Kyle. I have a question for you in a moment, but before we do that, let's go ahead and launch our first live poll. I know a number of you are with healthcare facilities attendees, are with an actual healthcare facility. Many of you are maybe with a local government or with consultant firms and others who may not be at a facility, but in some cases you work or collaborate with others. So please interpret this question based on that, but encourage you to respond to this. Where have you seen success, either with facility you work with directly or ones that you're familiar with and have worked indirectly? And while folks are responding to that, question for you, Kyle, is just sort of a 101 with the waste audits that you guys did. Could you describe a little bit more the process of how you actually did the audits, knowing that this is a little trickier with this kind of waste stream, especially with the medical, but what sort of protocols, system did you have in place? Any words of wisdom for other healthcare facilities that might be looking to do similar?
Yeah, I mean, we have a relationship with the medical school at Brown University, where I work as faculty. So it was really easy for us to work with medical students who are interested in this initiative. And we had a group of 10 to 15 volunteers who are willing to come and participate in sorting through the waste over the course of a weekend. So we did it, we did this audit, and then we had students who were dressed in personal protective equipment and went through the material to sort it into the different categories. And they had conducted, the same group of medical students who did the audit at Kent did the audit at Mass General. So they had the experience in doing a prior audit and knew all of the methods for sorting through everything. What I would say is make sure everybody's safe. So everybody who's doing the sorting has to have personal protective equipment. And then you also need to have a scenario where you have a space where you can sort that material. And that was actually the most difficult problem to solve in both of the audits, was finding a space in the hospital setting to sort through everything. And one of the things that we discussed was even potentially on a warmer day, sorting through the materials outside under a tent or something along those lines. So you've got to have volunteers. You have to work with environmental services so that they know what materials to isolate for sorting into different categories so that you can conduct the audit appropriately. And then you have to have volunteers or staff to sort through things, and then something in order to weigh the material as well. And then we used a waste calculator, which is available open access online, in order to calculate the carbon footprint. In order to do that, you need to know several additional things, including whether you have any sort of in-house sterilization, or as well as what transportation is used to your waste disposal sites for regulated medical waste, as well as municipal solid waste. So that's a very long answer to your question, Alec. But I think, in any of the resources that I shared with you that people will be able to read, the methods that we used for each of the waste audits are available. And I'm certainly happy to answer any questions that people might have otherwise. Great.
Good. And I will point out that we've been dropping links into the chat pointing to the actual study and a poster and other resources that Kyle shared. So if you are interested to look into some of these further, just go into the link or go into the chat to pull out the link for those. We have a couple more questions. I'm going to go ahead and park these just so we can keep the program going, but thanks, Kyle. So let's, Rebecca, can we pull up the results? Looks like roughly 17% responded saying that they've been able to remove unnecessary supplies from OR packs. 47% have been able to do recycling collections for blue wrap and some of the other hard to recover materials. 23% replacing single-use items with reusable or refurbished. And 38% are having a hard time. They've not been able to get programs in place, and that's not surprising because certainly it is a challenging setting. Again, would love to hear if there are specific examples of what you've done that you think are noteworthy, from any of these practices that you're doing, please drop them into the chat, share them with others, and we'd love to see what others are doing. So let's go ahead, if we can close the poll, and then we'll go on to our next presenter. So let me then introduce Glenn Goodsale, who is the recycling coordinator of the Mayo Clinic. And Glenn, let you take it from there.
Hi, thank you. Yes, I'm Glenn Goodsale. I'm the recycling coordinator here at the Mayo Clinic in Rochester, Minnesota, and just kind of want to go over what we do at our recycling center, just to show you what kind of, how we handle things, and gives you a little background on Mayo Clinic in Rochester. We have 3 campuses. We have our outpatient, our main campus downtown, and our 2 large hospitals. Founded over 150 years ago, Mayo is guided by its patient comes first core value and dedicated to delivering medical excellence through a team-based approach. One of the main core values is stewardship, that we rely on a lot, sustain and reinvest in our mission and extended communities by wisely managing our human and natural resources. And we fall back on this a lot to try to get different groups to help us with this recycling process that we're doing. We have our own recycling center. I'll go over, we truck it all in here. We're located near the downtown, so it's all in-house. We have these trucks that go out. We go to 50 plus dock stops a day. So there's a lot of different buildings, a lot of different things going on. We have our 2 full-time drivers, 2 night drivers, and 7 processors. And we just take the empty carts back out to be refilled, bring the full ones in, and process throughout the day. A little walk around our recycling center. We're in a warehouse, about 26,328 square feet, and you can kind of see some of the items we handle. It might sound like, a pretty big area, but we've got it full, and we have to keep things moving in and out and keep things organized. And everything's processed within the day. Just to start off, we do our, you don't think about it, but you throw your beverage container, your pop bottle into a recycling container. Where does it go from there? Well, it gets handled by our EVS people, brought to the loading docks, brought out here. And this is an example of a day's. The guys get here in the morning from the night drivers, brought all this stuff in. They have to handle this all, repackages into it and send it on to a third party to sort it out into its different commodities. We used to do it in-house. It just got to be too much for us. And so now we have another third-party vendor we go through. We do a lot of styrofoam recycling with cooler boxes. Cooler boxes get sent from all over the world with samples and things to be tested. We recycle them. We send them through our densifier. And any computer packaging, any other packaging. We don't do food, like styrofoam plates or cups, but all the bigger styrofoam items of packaging, and especially the cooler boxes. We did 117,000 pounds last year, and that was a COVID year, 2020. So we do a lot, and it actually gets made right back into a styrofoam product that can be reused as a packaging or a cooler box again. Blue wrap, we got into the surgical areas. We work very closely with our surgical services and our ER and OR places, and they fill these blue wrap bags. We bring them back to the recycling center, and it's continually involved with adding more and more and more to this. The paper doesn't come through here. The paper comes separately, but we get all these trays and packaging material that are allowed to come through, and we can send those on to all be recycled. So we get a big bag, and it's half full of blue wrap, and it's half full of all this other plastic that does get recycled. research. Mayo has a lot of research going on. There's an example of PET mouse houses that we can recycle just like a water bottle and send that on. Clear plastic. We have these stands set up all across campus at our busy loading docks, at our busier supply chain areas and linen. And we collect it in these big bags, get it brought back here, and just kind of showed a guy that just lift it off into a baler and bale it up, and it's a sellable film plastic. White trays from surgery. We get thousands of these trays weekly. And it kind of, our baler was broke down for a little bit, so we had them stacked up. And here's a picture, and you know, you think that's just a commodity. Well, every one of those trays represents a patient that came through for a medical procedure, and hopefully, you know, was life-changing or helped them. So it kind of makes you sit back and you know, realize really what we're doing and why we're doing it here. Our green bag plastic, from the research areas and our patient care areas, started out just recycling these as a number 5 polypropylene, and it's just grown into anything rigid plastic, throw it in the bag. This is a day's worth of plastic. That used to go in the trash every day, and now we're pulling that much out. We're pulling, you know, tons out a week of this type of plastic and recycling it all. We're sorting out the polypropylene, regrinding it. Kind of shows our old repurposed conveyor that goes into our brand new shredder, and the shredder shreds it, blows it up and into this box, and comes out as a regrind product that we can sell right back in. There's several buyers for this. It's a good virgin material. Well, it's a regrind material that they can use into making new products out of the polypropylene. And with that, we have to sort out the other plastics. And we have a home that guys buying this from us. We regrind it also, send it off, and it can get made into pavers or landscape blocks and any composite blocks. Here's an example. Our grounds crew bought this. We had a local company that was making landscape blocking and decking, and they bought a bunch and put it in our green spaces around campus. And so I set down an example of all this plastic that we've taken all of our waste stream, and now we're reusing it here in-house. And the blue wrap is actually, our blue wrap is actually being made into back into these blue trays and bedpans and stuff from a company. So we're just always trying to connect the circle to just, you know, have an outlet and a good recycled product out of our material. And just setting this up, but just wanted to go over how we have to go to each site, each healthcare part, each patient care area, talk to them, get them on board, and get them set up to do the right thing. So we're not getting trash brought back here just to throw away, because it all has to be sorted through. And we start them out with a good example of how to do it, and meet with them and get the program up and running better. And just a shout out for the ongoing environmental management practice we're also doing downtown. There's a lot of things going on. I'm just out here, the recycle guy out here, but our medical supplies, we send a lot of reusable equipment and supplies to our Rochester Medical Missions Group. Our energy and water conservation practices are all being managed by our facilities management department. We have 3 power generating plants on site around the campuses, and they're all looking at conservation programs for heating and cooling. Greening the supply purchases and reusable products, it's all being looked at and worked on by our supply chain. I'm going to make a shout out to our sustainability person, Amanda Holloway, who coordinates many programs across campus to reduce waste and other groups, and to minimize our waste and getting everyone on board on some of these programs. Our medical equipment processing, reprocessing, we work with the Medline Industries company to reprocess a lot of the medical equipment or devices, and then our HTM biomed equipment repair and resale. They kind of manage our biomedical equipment. So that's kind of the extent. Is a quick run through, but we try to eliminate as much waste as we can from our waste stream.
Great, thanks, Glenn. That was a great lightning fast overview.
I was
helpful.
waiting for the hook to come out and pull me off the stage and say, time's up.
Yep. We have a number of questions that have come in for you, but before we do, let me just launch our next poll question. And this one comes to just understanding the reality that COVID has changed a lot, obviously, in all different aspects of how we do our jobs, but it's also had a big impact on how we consume and how we're using things. So this is the question just to better understand how it may or may not be affecting waste reduction efforts that, again, either you're directly involved with or organizations, programs that you work indirectly with. A question for you, Glenn. We had this is a very specific one, but from Benjamin was asking, do you rebate the silver funds collected from X-rays to the source?
Actually, we do. We're set up. We have a vendor that takes our X-ray film and shreds it and collects the silver, and they recycle the PET of the film itself and the jacket and typically the revenue back on most of our things, because we do paper, we do metals, we do cardboard, we do our plastics and stuff, we get money back, but we get revenue back here, and we are that goes back into our general fund. Here with our X-ray film specifically goes back into our radiology department, but which in turn goes back to our into the general fund.
Okay, great. Again, I'm going to hold these questions, the remaining questions for the end, just so we can go through all of our presentations. But briefly coming back to the poll results, looks like we had 74% have confirmed that they've seen a significant increase in the waste just being generated, and that's obviously in a lot of cases things have been shifted back over towards a single use versus a reusable. 51% specifically citing that labor shortage has also been a significant issue. So this is interesting to see these results. So let's go ahead and close this out, and let's move on then to our next presentation. And I will Sonia Janasek and Marianne Dawson, and remind me which one of you is going to lead the slides. Should I give control to?
Marianne, please.
Okay. Great, and I'll hand it over.
Thank you. So hello, everyone. I'm Sonia Janasek, and I'm here with my colleague, Marianne Dawson. And yeah, we're going to talk to you about waste prevention in healthcare. So I'll tell you a little bit about ourselves while I wait for the slide to change. So we are an environmental sustainability team that works for the BC healthcare organizations in the Metro Vancouver area or the Lower Mainland. We actually work for 4 of the 8 health authorities in the province of British Columbia, which represents about 60 sites, 24 of which are acute care hospitals. And then we have long-term care as well as cancer centers and mental health. So for today, I'm just going to quickly touch on why it's important for us to think upstream and not just about how we're recycling our waste, but also what we're doing to avoid waste from coming into the healthcare setting in the first place. And then Marianne's going to share a couple of case studies demonstrating how we're doing this, as well as some of the things that we find exciting on the horizon. So recycling in our facilities. So we set our target of 50% waste diversion by 2030. And we actually originally started out with a 70% waste diversion target as an aspiration based on some progressive municipalities in our area, but quickly realized that 70% was not going to be achievable for us. And so we actually decided, okay, let's go for 50. But what we've actually seen is since implementing a standardized recycling program across these 60 sites, we are just plateauing at around 40%. Of course, there are certain smaller sites that have reached the 50 and even beyond, but for the most part, we're just not seeing that 50% waste diversion that we'd like. And we calculate our waste diversion to include waste and recyclables, so it doesn't include our biomedical waste. Next slide. So it's really important for us to think beyond recycling because we're just plateauing at this 40%. But it's also because global recycling markets are actually shrinking. We used to have slightly higher recycling diversion rates when we were able to recycle soft plastics. But as soon as that program was taken away from us, due to a global industry not wanting as many soft plastics or the fear of them being contaminated, we saw immediately that our recycling rate went down. And then when we look at ourselves provincially, we just don't have a robust recycling industry, which causes us to have many limitations. There are also a lot of perceptions around hospital waste. Many recycling vendors don't want to receive things that they perceive to be potentially contaminated because they are hand sorting these items. So that's another important thing to think of. Lastly, the use of plastics in delivery of care is not going to go away. Plastics are important for sterilization, but what makes them really tricky is not just the perception that they could be contaminated, but even if we could prove, just as actually Kyle's audits prove that there's so many unused items, they're often of mixed materials. So that might be soft plastic packaging with paper on the outside, or hard plastic with paper on the outside, or metal or rubber. And you can't separate those easily, and there's no recycling vendor that we have available to us to do that. So these are all sort of the reasons why we just need to look upstream for some ways to actually avoid waste from coming into our health system in the first place. So I'll let Marianne share some of the ways that we're doing that.
Thank you so much, Sonia, for setting that up. So yes, we're going to look at 2 different case studies that we have done in our area. So the first case study comes from nurses in the postpartum unit at our BC Women's Hospital. And what they found is this one product called a SITS basin. It came with this bag and tubing that you can see on the left. But what the nurses were finding is that they were never using these 2 components, the bag and the tube. So they were throwing out every single one that they were using. And as really high volume users, as the large women's hospital in British Columbia, they were throwing away, they estimated, close to 300 kilograms of plastic waste in a year. So a very long story short, and if anyone wants any details, happy to share later. But essentially what these nurses did is they filled out a formal product concern form, which raised the issue with our team and our provincial supply chain team. And our supply chain team worked directly with the vendor, and through all this different engagement, ended up being able to offer this product without the gradient bag and the tubing. So this obviously saved all of that plastic waste. And what's even nicer about this is that our provincial supply chain team, they do work for all of the health authorities in the province. So now this product is available not only to the groups that we work with, but it's available to any of the health organizations in the rest of the province. If they still want to use the version with the bag and the tubing because they use it, they can get it. But if they don't, then they also have access to this, this other product. So that was a huge success for us. In our other case study, it's actually still ongoing. So we'll see the results of this one as we go. But this is about reformulating surgical packs. We've known about this issue, but this really came to light because we used a crowdsourcing platform with our staff to talk about environmental sustainability issues and especially waste in the OR. So medical staff highlighted that surgical packs are obviously a huge source of waste. And then we had this opportunity come up where our contract was being renewed. And so now we have a chance to get into these contractual discussions, join the RFP committee, and try to figure out what we can do to eliminate unnecessary waste here. So our team did a presentation to the committee, talked about these issues, and one of the high priorities that came out of it was to look at removing disposable gowns that come pre-packaged in this pack. So it comes with all of these other products that a clinician might need for a procedure. A lot of them also include a disposable gown. The issue being that the vast majority of our sites use entirely reusable gowns. So the disposable gowns that were included in the pack were just being thrown out without being used. So again, as I mentioned, we're not done this process yet. We're still in the journey, but the committee for this RFP did decide to add 5% weighting for environmental sustainability questions. And it raised their interest in learning more about how can we be more strategic with procuring our gowns, knowing that we have these reusable gowns. How can we complement what we already have going on in all of our different products, including these surgical packs. So it got everyone talking about a more regional, larger gown strategy to avoid this unnecessary waste. So we are very excited about what's happening in our area and what we hope to see going forward. Our provincial supply chain team has a new sustainability committee. So they will be looking at all things sustainability within procurement, which is very exciting. We have increasing interest and sponsorship from our health authority executive teams, all the way to adding positions, executive and director level positions for this work, and getting this work into more clinical areas, not just the operational, the recycling side, but clinical processes, improving those. And we do have support from our provincial government. And very recently, the BC government added circular economy to the 2030 strategic roadmap to net zero emissions. And since we are a public sector organization, our government expects us to be leaders with all of their priorities. And so if they're adding circular economy to the strategy, that kind of means that all our health organizations will need to make this a priority as well. So we are looking forward to the future and where we'll be able to take this waste prevention work. If you do want to learn more about our work, you can check our website out at bcgreencare.ca. And that's all from us. Thank you.
Great. Thank you, Mary Ann and Sonia. So as a reminder, if you have questions for any of our speakers, go ahead and put that into the Q&A field. I don't have any new questions that have come in specific to your presentation. So let's go ahead and just shift over and let me bring over Margie Wood and have her make a quick introduction to her program, and then we'll jump into the panel and we'll come back to additional questions. So with that, Margie, go ahead and take it away.
There, okay. Thanks, Alec. It's good to join all of you today and be involved in the webinar. It's awesome to see so many great things going on. First, a little bit about our hospital. We're a suburb of Denver in about 160 beds. We have 13 surgical suites. Next slide. Okay, so this shows is, you know, you heard about before is the blue wrap issue. We've, you know, blue wrap is used to wrap so many instruments for sterilization, and we've had some issues in the past with what to do with it. So we did start recycling it with a company that employed disabled adults. They came into the hospital and collected it, and then took it back and sorted it, and that all stopped with COVID. They were no longer able to come into the hospital. So it was temporarily put on hold, and then it was discontinued permanently. So unfortunately, we started throwing all of our blue wrap away again. We are able to use some of it. We have some volunteers here at the hospital that help us reuse some of it to make sleep mats and tote bags that we pass out at the homeless shelter. So that's awesome that we can do that with some of it. And then we've actually been able to replace a lot of it with metal caskets. A couple of years ago, our hospital purchased many caskets. So I think about 40% of our instruments now are in metal caskets instead of using blue wrap. So that's great that, that of course, as you heard also before, that, you know, reduction is much better than recycling anyway. So that's awesome. Next slide. So these are just a few of our little programs. We save our gently used batteries from the suction irrigators, from the operating rooms, and from telemetry. We save them in little blood tube holders from the lab, that are styrofoam ones, so that they're not dangerous as we store them. And we pass those out at the information desk and to staff and visitors. And then we also, like right now, this time of year, we save them for the Santa shop for the needy kids that come shopping for that. So that's kind of a nice little thing that we do. And then these two pictures show, this is our Earth Day celebration. We have an annual Earth Day celebration, and that's where we do a lot of our education. We get people all fired up and have all kinds of displays and prizes and all. And probably about 20 booths where we educate people on the different programs that we do at our hospital and different environmental things. So this is just the battery education program. And then this gentleman has a poster that about Project Cure. He's one of our volunteers at Project Cure. And so we save a lot of our unneeded supplies from surgery and throughout the hospital, maybe expired, and send them to Project Cure, which is an organization. It's a worldwide organization, and they send them to about 135 countries worldwide. And the headquarters happens to be here in Denver. So that's awesome. I volunteer there at the headquarters a lot. So learn a lot about that. This is Stephanie. She's one of our nurses that won the Wally Award last year. We have a sustainability award that we give out, and we pass Wally around to the different departments. So wherever you work, he's on display, and hopefully that encourages people to ask about him and why we have a Wally Award. So that's kind of fun. A couple other things we do, just saving items for nursing students, for nursing schools, expired IV fluids, betadine, saving them for animal rescues and vets. The disposable instruments, the one-time use instruments, we sterilize them and then pass them out at our Earth Day celebration, the little scissors and clamps that people really like. The card stock from our daily autoclave checks, we pass those out for note cards. So it's a lot of little things, but we feel that they add up. So next slide. And lastly, this just is a picture that you've seen before of the number 5 plastic bottles. We use maybe 2 to 4 of these every day for each case in the operating room. And these are easy to recycle for us, although throughout the hospital, we have a lot of problems trying to segregate things appropriately for recycling. This is easy because that's all you put in these bags are these number 5 bottles. So that is one thing that we are very good at recycling right now. And then this picture is just, these are some of the tourniquets we use for ortho cases in the operating room. And this shows we collect these and then send them to Stryker Sustainability. They have a big recycling or reprocessing program where they reprocess them and then sell them back to hospitals. And that's one of our issues right now is we save a bunch. We're great at saving a lot of our single-use devices, but we don't have the process in place to buy them back yet. So hopefully that's coming in 2022. But just a lot of things we're working on, and hopefully a lot of inspiration today. So hopefully we can only get better. So thank you.
Great, thanks, Margie. So let's go ahead and shift over. We're done with our presentation, so now we're going to focus on more of the panel discussion. So if each of our panelists could turn on their screens, I'm going to turn off the slides, and let's just jump in. We've had a number of questions coming in, but I'd say I'd like to start out with my own question. When we were all talking with the panel before today's session, we were prepping for this, and I remember I posed the question of, where are the low-hanging fruit? If you're a hospital or healthcare facility that is looking to make headway, maybe not with a lot of resources, minimal budget, but where are there some of the easy things to be taken? And the my first thing that popped out for me as a question, not working directly in the healthcare facility, but it was the observation, Kyle, from the study you did about all the RMW waste that is showing up in, all the traditional MSW, non-hazardous material that ends up in the red bag and the RMW, and what a significant both cost but also environmental impact that can be because of the fact that it has to get autoclaved, and there's a lot more involved with that. And so my assumption would be that would be a relatively easy step to take because there's a big cost savings potentially, and that should be an incentive. But the response I heard from a number of you was, well, that doesn't mean it's necessarily easy to address. But I guess can I put that question out there? Is this seems to be a fairly widespread issue of how you keep stuff from simply being missorted into the medical side, and any observations or thoughts on how to address that? Carol, I guess, do you want to start out with that question?
Yeah, I think one of the things that we talked about was, certainly staff education is something that plays a big role in appropriate disposal of things like municipal solid waste and regulated medical waste. So making sure that staff are aware of what qualifies as regulated medical waste. And then thinking about things like design of your emergency department. So making it convenient for people to dispose of waste in appropriate locations. So education and then thinking about ED design are two different things that I would say are good ways to get people to dispose of materials in appropriate locations. And that's not just referring to like regulated medical waste and municipal solid waste. We're also talking about recycling streams. And in the emergency department setting where I work, I think education and design, and then integrating it into a more like cultural practice over time. Because initially you're going to run into barriers, you're going to run into some resistance from staff, and then you're going to have to overcome those barriers with persistence. And it really helps to have buy-in from people who are a part of your staff as well. And at our hospital facilities and where I work in Rhode Island at Kent, and at some of the hospitals that are part of the Brown system, we have green teams who advocate for these sorts of policies in our emergency departments and throughout the hospital. And that can help to motivate some of these cultural changes. So just to summarize, education, design, convenience, and then getting staff buy-in and cultural change.
Mm-hmm.
Can I add one thing, Alec, to that?
Please.
I agree with everything Kyle said, and I want to add also, develop a good relationship with your recycling vendor. Know what their risk tolerance is. What are they willing to take and what are they not willing to take if you're thinking about starting a recycling program? I think that's really important.
And if I could add, I think a lot of the items that we saw that, you had in your little video, a lot of our issue at our hospital is that we have to throw all those items away once they've been in a room where there's a patient. And so even though it's an unopened package, A lot of the regulations, the Medicare regulation and Joint Commission say you can't reuse those items and put them back in storage. So that's what we end up throwing. We actually donate a lot of that stuff to Project Cure, but that's very sad that so many of those things just can't be because of regulations, can't be. So it's hard to not take things in the room that you might not need, but that's a big education thing, to educate staff not to take items in if they might not use them. So thanks.
Yeah, I just to piggyback off that, Margie, I think infection control policies are something that really affect the amount of unused medical items that end up in our waste stream in the emergency department. And then part of, initiatives to try to reduce those unused items are, one, improving education about placing patients in appropriate categories for infection control. So we have various categories based on patient presentation. And then two, is like you said, Margie, what items do you bring into the room? And I think part of the reason why we saw a large number of resuscitation supplies in unused resuscitation supplies is because when you're doing a resuscitation in the ED, you want to have everything ready in case things go south quickly. And I think that's why, after a resuscitation, you see an abundance of unused supplies in our waste stream. So that's certainly an area that we want to work with our staff and kind of brainstorm and figure out some areas where, like Sonia and Marianne, how we can get staff to kind of drive the interventions that we do to try to reduce some of the unused medical items in our waste.
Yep. Let me back up and go back to another part of the question that I posed about where some of the low hanging fruit is, or some of the relatively steps that could be taken. Sonia, you had mentioned when we had this discussion, just some fundamentals about the collection infrastructure, about standardizing, coming up with a uniform system, which resonates with me. I think this is true across a lot of different sectors. It's not specific to healthcare, but it's about just you're dealing with staff and humans who are subject to confusion. They have the same convenience factors that you're trying to address, but also there's the reality of the pressure of being in an operating room and areas like that. And so you've got to have a system that's intuitive and set up. Can you talk a little bit more about, from your experience, how the infrastructure, how that can impact and how that can be influenced?
Yeah, absolutely. I mean, immediately I think of our context where we have staff and patients visiting different sites in the area because they might need one treatment in one place, or they might be, staff at various hospitals. So they need it to be standardized. They need to know that when they walk into any one of our facilities, they're going to be met with the exact same recycling program. And certainly it wasn't always that way. And it took us a number of years to implement that program across all of our sites in close collaboration with our recycling vendor, understanding what they were willing to take and what they weren't. And we actually had to adjust what was allowed in the recycling stream many, many times during that process. And I think that it's not just the standardized program, but I'm going to agree with the idea of space. It has to be in a convenient place and there has to be space for it. So when we're dealing with our existing facilities, that's a huge challenge because there are so many, everyone's fighting for space to place equipment, to place supplies, for patient care, for beds, whatever it is. So in our existing facilities, that can be a challenge. So I'm going to say there is a huge opportunity in new facilities. When you're constructing a new facility or renovating, think about where are the recycling and the waste and the biomedical waste bins going to go. And they should all be put together in a way that it's convenient and it reduces contamination. So you don't want the biomedical bin right next to the recycling bin.
Mm-hmm. Margie, from your perspective, in the moment, is there any advice or thoughts about how things are arranged or how they're set up to be intuitive, to sort of guide staff to handle things correctly?
You know, I think certain things, like I said, the water bottles work great because that's the only bin that I have in one corner of one area where everybody has to take their carts. Other things, you know, it's hard because sometimes I don't know if you should have them next to each other. Which one will people just, do they care enough to put it in the right one? Or if they're distant, do they just not care and throw it in the one that that isn't close by? I think that's a tough thing to figure out. And our big issue at our hospital, of course, is space. You know, we don't have space for many things. So, and our loading dock is especially, you know, we don't have space for a baler. We don't have space for a lot of items. So, yeah, so I think that's kind of a tough issue to figure out. So.
Yep. Good. We have a number of questions have come in just on a more specific on the recycling end of opportunities. So you have one, Alyssa, I had a question for Glenn, going back to, you were talking about the EPS, the polystyrene densifying and it was being made back into EPS packaging. Is there any more information, detail you could share about how that worked?
We have a pretty steady vendor buyer that purchases it, and he has a outlet nearby. It's near Chicago that they use. They dump it into a slurry. We don't change its state. That's the polystyrene. It's expanded, so it's got the beads, and so we compress it. We just don't change its state. They dump it into a slurry, and they can make it into, he says they're making it into insulation sheets that are about 2.5 inches thick. Ours has these little stickers because most cooler boxes have a sticker in the inside of them, and we get a little discounted for that, but they don't have a problem with it. But it's not, with that sticker, not high enough grade to be made into a real nice cooler like we're using. But right now, he showed me pictures of the place that they make it into the flat insulation, though, like the 4x8 sheets of styrofoam insulation.
Got it.
And on that, I guess I just wanted to throw in, you know, we're doing other plastics here, and it's nice to be able to do a variety of things because we can put them all in a truck, and he'll purchase, you know, our film plastic and our white trays, and so he's got outlets for other things that are using, and so we don't have to stockpile a whole semi-load. We can, you know, move things together in a combo load, which helps us out.
Yeah, which I think that points to an issue that, Margie, you also kind of touched on with, you know, depending on the type of the size of your facility, where you're geographically located, your access to recycling markets can fluctuate dramatically. Opportunities that, you know, Glenn, you've got facilities, you've got the ability to fail to do that, all that processing, but a small hospital doesn't, or you may be in an area where you simply don't have access to those markets.
Right.
It'd be a real challenge. Good. Julie had a question. They use the mouse houses, also containers, but they often come with metal attachments that are difficult to separate from the plastics. Do they just need to find a different type of cage to use? Or?
Yeah, I don't know. We work with our comparative medicine folks that offer those back to us. Some are contaminated, which, you know, we can't recycle. But most often they're dumped, cleaned out, and they're clean and free. They're all plastic. There's a little bit of like a filter on some of the lids, but we've never had a problem with the buyer that's been taking them. So I don't know on that about a different product. I think the mice are really happy with them.
Okay. Good. Let's talk a little bit about just the role of education, because you can, whatever opportunities you have, programs that you could implement for either recovering or for trying to prevent materials being used. I think all of you in one way or another are touched on the fact that a lot of this has to do with actually engaging the staff and how do you get them to participate. So I'd love to explore that a little bit more. From your experience, what have you, I guess why don't we start with this OR staff and procedural areas. Are there ways of organizing or how you approach engaging and educating words of wisdom that either of you could share?
So I'd say in the operating room, a lot of it is, we have a huddle every morning, and I might bring something to huddle and say, where does this go? And, or just bring up one little item that, takes 10 seconds because everybody needs to get to their rooms. And so it's kind of a daily thing. Plus we do little things like I caught you being green, and I'll just hang up a poster and explain why someone won that, what they've done recently, if someone's going above and beyond. And our Wally Award that goes throughout the hospital, that's, we try to get people just asking questions and finding out about things. But no, it's the education, we do it, and we do our Earth Day education yearly. We have eagles, we have birds of prey and hawks, and so we really draw a lot of people in to try to get them there, and then that's when we do a lot of the education. But a month later we'll still hear from someone, I didn't know we were doing that. And education's hard. We do online newsletters, but everybody doesn't read them. So it's just a continuous, it helps having this green team. So it's just volunteers from different departments come to our meetings, and we have them every month or two. And then they go back to their units and spread the word. So that's how we try to educate, at our hospital.
Mm-hmm.
Yeah, I would just echo that. I mean, in the emergency department and in the hospitals here in Rhode Island where I work, the green teams are really what motivate the initiatives that we have. So staff from different departments are able to identify problems that they see where potential interventions can take place. And when you have staff who are interested in spearheading efforts, they can work with other staff members and motivate change. And you have to have staff buy-in in order for education to stick, and any sort of initiative that you do to really have any sort of substantive change going forward. And then the other thing that I would say is you have to have monitoring and evaluation. So whatever initiative that you're doing, you need to be monitoring that initiative to see whether it's effective or not. And if it's not effective, then you need to try something else and go a different direction. And I think that's a really important thing to have in place for everything that you're going to be doing in regards to trying to improve sustainability, reduce environmental impact, and cut costs in the hospital. Is you have to be monitoring to see what the interventions that you're doing and whether they're being effective or not, whether they're achieving the goals that you're looking for. And that can be a challenge in and of itself, because you might not have the resources depending on how big or small your hospital system is.
Mm-hmm.
And in my experience, healthcare staff are some of the most passionate, engaged people I have ever met. So I found there's no lack of desire or passion to green the workplace or contribute in some way to sustainability. Like they know. Like it's very rare that we've come across someone that was resistant to a sustainability change. What we find is difficult is time, effort, knowledge, expertise, direction. That's the really challenging part. If there's a perceived increase in workload, that's a big issue, because healthcare staff are also some of the most overworked people I've ever met. But in our area, what we've tried to do is kind of harness all of this passion into one coordinated volunteer program called the Green Plus Leaders, and it's across the whole region. And it allows staff to talk to each other, try to get encouragement from what other people are doing, attend webinars and sessions that we put on so that they can learn more, share case studies and things that we've seen that work, just to kind of keep that motivation going, and then provide support. So if there is a project idea, or they've identified something that they want to work on, that our team can help support that, sometimes with funds, sometimes just with having to navigate the system. And that's how a lot of our case studies were successful, especially the one with removing the bag from the sit space. And that was staff identified, there was lots of passion, they just needed the direction and support.
I just want to add to this. Our goal is to get into the health care system orientation. So when a new staff comes on, we really want to be present, so that waste management becomes a part of that education. We've managed to do it in one of the health authorities, but not all. And then I would say also recently discovered the world of patient quality safety and embedding into their ways of doing things, and thinking about the environmental benefits as also quality care. And so I think that there's language that we can use and ways to think about issues that maybe are more familiar to healthcare staff, and that might be another great way to engage them as well.
I'll just say one last point. It just from the ED setting, even just identifying that waste is a problem has been a big thing for us, because ED staff didn't even recognize that they were wasting as much as they were. So even just identifying the problem and publicizing the problem is a way of, motivating staff to recognize the issue and try to come up with solutions, or even just recognize the issue. Even just recognizing there's a problem is an important thing.
Yeah, really making the connection that that it has an impact. And it's not just on the discard side, but it's also on the upfront. A lot of the environmental impact comes from producing items. There are a couple of things I think that have been cited that I would emphasize. One, when it comes to the motivation and getting people engaged, Kyle, you made reference to showing results, being able to monitor and track and show this is what we've actually done. And there's a lot of evidence on behavioral research shows that letting people know that their effort results in something concrete is a big part of how you get them to buy in and engage with it. Somebody does not have to be an environmentalist on their own, but you have to know that I'm making the effort to sort these things and to follow the protocols that are set out, connecting people to this is what our actual impact was. This is what our reduction in GHG was, or whatever those metrics are. Being able to communicate that is a big part of how you get people to buy in. And the other one that I think that I have a great appreciation for is just the upfront involvement in when you're designing a system, giving staff the sense that they have a stake in the system that's been set up. You've listened to them, you've gotten their feedback, in terms of where bins go or how it's set up, letting them know that they're part of that gives them more of a stake and buy-in. That's another point I would support. Yeah, let's talk a little bit, shift and come back over towards the prevention side and what some of the things we were talking about and opportunities to reduce and not simply recycle, because as we all know, recycling is great, but the real impact is from the consuming things. But there are a lot of barriers there to overcome. Margie, we had, when we were talking initially, you cited the example of how a lot of the instruments that are used, they can be refurbished. You send a Stryker, one of the companies that does refurbishing, but your hospital is not currently actually purchasing the refurbished items. Could you talk a little bit more about that? What's happening?
Yeah, I know. Part of the issue we've had a big turnover with staff, as a lot of hospitals, with our supply chain, and it's just supply chain has a perception, whether it's real or not, that it's more complicated to order items reprocessed, because what if they go to order something and they don't have enough at the company? But I think it's more just getting started and we have a new manager, and I think once it gets started and people are truly educated about it, it sounds like there's a plan to start it in 2022 to do the buyback part of it. But it was initially put in place because it's also a money saving to buy reprocessed things. A lot of times you can buy them back at a significantly lower rate than if you bought them new. It's just, I think, getting it started. It just needs to be figured out, I think, and somebody has to care about it in supply chain. And that's what we're kind of, trying to work with and encourage, because, we're doing the sustainable part and we're saving, lots and lots of items, but it's just, we need to do the other part too.
Yeah.
I know there's I thought somebody maybe, talking to some of the docs, that there's a perception that a lot of the items that they're leery about them because they're used items and they're meant to be used one time. But the Stryker takes on the responsibility of being the new manufacturer. And there's actually been studies done. I think the last one I saw was in 2016, that the reprocessed items actually, in this study, had a much lower failure rate than the brand new items. So that was kind of interesting. So we try to point that out to doctors, and that it's FDA approved, but they're still leery sometimes. So it just takes a lot of education.
A big part of the job is addressing a culture that legitimately is conservative about change, but where, and
rightfully so, they want to make sure that they trust their items, and you want someone that to do. But we used to do reprocessing a few years ago with another company, and it's kind of changed over time too. So
yeah. I know we were talking about gowns and reusable gowns, and that's another relatively low-hanging fruit, as it were, opportunity to move away from disposables, where there could be a clear cost savings if you're looking at the long term, not just the capital expense. But there also, that's another thing that it takes actually getting it implemented. I know, Sonia and Marianne, that's something that's being done at the facilities where you work at, the shift. Could you talk a little bit more about how that has worked?
Yeah, so it's kind of on a organization by organization basis, and also really down to facility by facility, the kind of uptake. At this point, most of the facilities in our region are doing majority reusable gowns, so isolation and surgical, and some of them are doing 100% reusable cloth gowns. And a recent case study from a site that was still using majority disposable, during the pandemic, there were supply chain issues. There was concern and worry that we would not be able to get enough disposable gowns. So they started a project to supplement the stock with reusable gowns. So that was it was just a supplement, just to, let's get us through the supply chain shortage. It was such a success that they ended up going from 96% disposable to 98% reusable, because everyone loved them so much more. They found that they were, on a per use basis, they were 9 times cheaper. And in just 6 months, they saved over $2 million just from that one change. So massive, massive success on every single level. The staff were happy, finance was happy, the planet's happy. So that was a really, really big success here.
Mm-hmm. And so that points to how do you get leadership to buy in to change? And this is one example of a pretty straightforward one, but even where it's not happening, having a communication strategy. It might even call it political strategy, but how do you message things to your leadership that reinforce not that it's a save the earth kind of thing, but that there's other substantial value to that. I would love if anybody has anything they want us to touch base in terms of what are some of the other ways that you could work with leadership to bring them along and build just more support for this or other changes. Does anybody want to jump in with some general thoughts on that?
I'll just say that it's definitely for us here in our area, it's a top-down and a bottom-up driver for leadership engagement. So top-down being our provincial legislation related to reducing carbon emissions and the circular economy and all that stuff. So we have to do it. The Health Authority leadership has agreed to a sustainability policy, and we're a team that is working collaboratively across the system to operationalize it. But we also talk about how important this is to staff and waste in particular, which is something that, you know, clinical staff have to open up packaging every day and throw it all out in our system. So they're, as Marianne said, extremely passionate. So I try and come at it like a sandwich. And then what we try and do is, we actually used to have an advisory committee at that leadership level, and we're looking at how we're going to revamp that to keep this on their radar throughout the year. Some of our health systems do have sustainability related targets that they see annually and or quarterly to know how we're doing, but it's certainly, I think the challenge for us now is they seem to be on board. We have, you know, pockets of staff on board. How do we get it through all the middle management? That's actually one of the bigger questions that I have, because we have decision makers throughout the system that are just being pulled in so many directions and really don't have the time to think about this.
And I think overall, a lot of it's money. If you can show that you're saving money, like I'm very interested in Marianne's study on the gowns. I mean, that's amazing. And staff is happy and that you were able to switch that. But like right now, we're trying to show that by getting a cardboard baler, that even though it would be expensive and to get the electricity run to run the baler for cardboard, that it would reduce so many man hours for our environmental services staff, cutting down on breaking up the cardboard and transporting it. And so if we can show that it will save money and how long it'll be before we save money, that's what we try to concentrate on, because it seems like management, you know, that's what they listen to. And unfortunately, we don't have all the mandates, you know, with the carbon emissions, and it's too bad we don't, but it seems to me that money talks from, you know, just from a nurse standpoint.
Yeah, that makes sense. And so we just have a few minutes left. This is a good segue in just in talking about more of the policy side. There's a lot that you can try to do from within an institution, but there is a role for having mandates, government regulation to really push things also. There's only so much that we can necessarily drive on our own, but would anybody like to address that? Talk about how it has worked in your area, what regulations have been in place that you're finding is helping to change the conversation and drive more support from leadership.
I think it's just a lot of it's geographic, Alec, and some of us happen to be in areas where we have more buy-in. Like in Rhode Island, we are probably the most liberal state in the US. So we have a very active legislature when it comes to green issues and sustainability. So our state legislature passed the Act on Climate bill last year, and that's focused on aggressive targets of lowering carbon emissions. And those undoubtedly include the healthcare sector. And if you can have a state government or a provincial government that's leading the charge, then you can have you have institutions who have to think about how to make these changes. And like Sonia said, it can be difficult to have that trickle down from the institutional level to the people who are going to be implementing it. And I think that's the real challenge when it comes to trying to find the most efficient way of solving the problem. But certainly, I mean, as part of our green teams and as part of, what, myself and my colleagues in healthcare in Rhode Island do is advocate on a legislative level for policies that we think are going to really make an impact on an institutional level. So I do think, we talk about green teams and starting from the bottom up, but I think that, green teams can also advocate for a top-down approach too. I think that there are certainly options, but then there's always the challenge of how do you implement the top-down. So it's not an easy problem.
None of these are easy, unfortunately, but nonetheless, where you can push and you can make big progress. Does anyone else want to add anything to that?
I'll just quickly share. So we are lucky that in BC we have a very progressive government legislation. We're legislated that all public sector organizations be carbon neutral. So we do pay carbon offsets. Obviously, we're still emitting, but we do have to pay for it. And then we have requirements around our buildings. So, building hospitals is a huge environmental impact, but we have requirements around, being LEED Gold or equivalent, a different climate resiliency and adaptation requirements. So it is coming down from legislation to do this. Even so, when you're working with large bureaucratic organizations, it absolutely takes time to keep trickling through for everyone to get the education they need. We stumble sometimes, but it's all kind of moving in the same direction. So that's kind of what legislation can do, is it can bring up the level of kind of learning and expertise with everyone over time.
Mm-hmm. I know, and something you had mentioned, Sonia, when we talked earlier is, for those that the constellation, if there is one, for those who are not necessarily in a progressive province or state where you don't necessarily have that kind of leadership on a regulatory level, is where, at least where it is, it's helping to drive the leadership and blazing the path, and it's over time providing the opportunity so we can point to, even in other states, other locations, this is possible, and be able to point to success as a reason to help drive it locally. Very last one. Another question for you, Marianne. Could you just talk a little bit about initiative I know that you've been involved with the Canadian Coalition around green health, and what they're doing around more of the circular economy side?
Yeah, so I see that Rebecca threw the link into the chat, so I encourage everyone to go check it out. But this is an exciting project where the Canadian Coalition for Green Healthcare got access to some federal funding for a multi-year project to look at what could circular PPE, what could that look like in Canada? What if we completely radically rethought our personal protective equipment in healthcare in Canada? Let's go big. Let's see what we can come up with. So it involves a lot of stakeholder engagement, scenarios, and then also the important part is linking networks of people that maybe don't always get a chance to talk together. So linking industry with healthcare, looking at what innovations are happening. And then kind of the tough part is going to be collating that all together into this set of recommendations or directions, and then getting healthcare organizations to kind of sign on to a pledge. So, will you pledge to move towards circular PPE? So it's we just finished a scenario part of the project, and so we've had some really great discussions about let's think wild, let's go crazy. What can we come up with to reduce disposable PPE in Canada? So yeah, that website should come up with updates as the project moves forward.
Yeah, great, thanks. And I did notice that they're from their website, there have been some recent webinars that they've done, I think you participated on, that they're doing more of a deep dive into the circular economy side. But I encourage folks who are interested on that to look up that site from the link that's in the chat and explore that further. Well, I want to thank each of you for participating. This is fantastic. Obviously, this is a topic that we can dive deeper into, and there are some great initiatives that are happening. Many of you are familiar with Practice Green Health and some of the other organizations that are doing work along in this area, and we'll be sharing information about those and all the things we've been putting into the chat. We will be posting those to our website in the next day or two. And we will have that along with the presentation slides from today and the recording. All those will be posted to our website, and we'll be sending out an email to everyone who registered today. So if you're interested to revisit any of these, you can find it on your own from this address on our website. I'll also point out that I have a website, my own blog series I do around waste issues, some of which touches on healthcare, but also just broader behavior and other aspects of how you set up recycling infrastructure. I encourage folks that you can check out from that website as well. But doing a recent one around signage, what do you put onto signs? Is it icons? Is it words? And showing some of the science behind how people just respond and react to signs is one of the recent topics that I've been covering. For those of you who may be doing CEU credits and you want to get credit for this program, feel free to reach out to us. My colleague Rebecca, Randy, we can provide a certificate of attendance and overview that you could share with any accreditation bodies that you're working with. So feel free to reach out to us. And then we're at the end of the program. So I just want to point out again, for those of you who are interested to stay on, the official program's over, but I do have colleagues who will be coming on in a moment who will be talking about some of the products, bin products that we create, and answer any questions that you have. But again, a final thank you to all of our panelists and everybody for joining. And I hope everyone has a good rest of your day. And I'll hand it over to you, Rebecca, and to Michelle and team.
Great, thank you, Alec. And again, thank you to all of our panelists today. I'm here with my colleague, Rebecca, and I'm Michelle. Again, thank you for the program today. As sales reps, we've certainly learned a lot, and it's really important for us to get a better understanding and a better idea of the challenges and the successes that you face in your industry so that we can turn around and take our products to support you. So we have been in business for over 35 years. And we do have a very active, actually, R&D department. And since COVID, we've really focused in on products that are geared towards PPE collection and keeping environments as safe spaces, along with the importance fact of just recycling and that collection and waste and diversion rates as well. So Rebecca and I are here today sort of to showcase our most popular products. We have brought some new products with us today as well, just to go over, again, that are geared towards healthcare. We have Rebecca behind the scenes as well. So if you have any questions at any time, feel free to jump in. We can stop the presentation at any moment and help answer those questions, or we can save them till the end as well and address them at that point. So with that said, Rebecca, if you want to start us off with our newest line, which is the Rise series.
Okay, so this is the Rise. Now, we were going to get a couple more Rebeccas to work with us just to make it a lot more confusing, but just Rebecca, Randy, and I will be taking over this. Okay, so this is our Rise. Now, as you can see, it's attached to the wall, so there is the space underneath here. This is just our demonstration one, obviously, because we didn't want to attach it to the wall in here. But these are 15 gallons each. And they have the lids on top with the signage in behind, and the signage is affixed to the wall as well. I don't know how clearly you can see this, but the signs just slide in nicely like that. We kind of put two on here for the presentation here. The lids just open nicely, and in order to change, they can get lifted off just like that to change the bags as well. Excuse me. They will withstand up to 45 pounds of weight, so you don't have to be too concerned about what is getting filled in here and if they're going to fall off. And if you want to see behind here, there is just the units. There's a metal bracket and some plastic here that they just hook onto on the wall here.
think Sonia mentioned a good point, which is the fact that space is really, really important, especially in older facilities. And that's sort of where the name came from, the rise, is off of the floor. So that way, if you are faced with any restraints in your space, you can take this whole system, and it's developed actually as a modular system. So we obviously only have 2 units side by side today, but you can create an entire track system, create a station of 4 or 5, whatever your collection is, whether it be masks or gloves, recycling, waste, you name it. These signs here are completely custom, along with the labels. We have a very, very talented graphics team who can create sort of any labeling and signage with picture icons that you're looking for. And as Rebecca mentioned too, it's on a track system. The lid is hinged, so it's hands-free as well. It reaches up, and you can bolt this track system into the wall. It can go into concrete. It can go into your regular
Drywall.
Thank you. Wall. We do stock them in both white and gray. I have seen the units in black as well as a custom color. So again, custom colors are options. Very, very smart looking, but also off the floor. So very easy for your janitorial staff to come in and clean underneath it. Or if you have things that you need to keep on the ground, maybe your lower baskets of, you know, tools, materials, whatever the case is, they can go underneath it.
One thing I did forget to mention as well is there is a label on the top right there, and there is a little slot here to hook the bags in, so the bag can just get wrapped around and slide right in there.
And you can see Rebecca's lifting it from the back handle. So ergonomically, it's extremely easy to dump into a larger collection container. All of our bins that we make and manufacture are ADA compliant as well. So we really focus on ergonomics and heavy lifting and things like that, which is why they only hold up to 45 pounds. Trying to think if we can think of anything else with this. These are just interchangeable. They slide quite nicely. So if you ever want to change them out, collect something different, your program changes it all, it's very easy. They do have nice finishings. If you want to grab one, Rebecca, we use this as a prototype here, and a small wall, but they actually have caps that fit on the ends of the system to make it look complete. So this is not open-ended. It's finished nicely, and that's the same with the tracking system along here. We've got 2 that as you can see, the track hangs over here, but normally it would be a nice complete looking unit. There we go. Okay. So that is our Rise collection, brand new series for us, and it's going over very, very well in the healthcare settings for the reasons that we've just gone over. Another product that we have developed since COVID are our new Prevail Carts. I know that there was a lot of successes that Marianne mentioned, I believe, or just, well, she actually had a lot of successes, but there was talk about reusable gowns as well. And I know that that's been used for this collection here. These signage, or this signage here is interchangeable. You can have custom signs on it as well. And one of the healthcare providers that we've been working with, we're collecting reusable gowns in here. So it's very easy. It's on wheels. It's a bag system, so it can be easy to change out. You can collect any materials, whether it be gloves, masks, any type of PPE, or recycling material that you are collecting. The dollies as well, they can be connected, so you can create a station as well on that. I don't know if you have anything to add.
I really don't. I just, the signage can be whatever you want. So it's really anything to be collected.
Okay. And I know there was a lot of talk today about education and green teams, and our focus for so long, I've actually been with the company for 12 years and Rebecca's going on 8 years. So our focus for so long was recycling and waste and diversion rates, and putting so much of an emphasis on the containers that we've manufactured towards developing successful programs. So we've brought some of our most popular indoor centralized stations with us today. Everything is manufactured in North America. And we as well, we hold the highest standards really when it comes to environmental accountability, social standards. We are a B Corp company, and that's really, really important to us. And we put those standards in everything that we make as well. So with that said, Rebecca, if you want to go into our
This is our waste watcher. This system here is modular, just like the Rise, and you can see that I have 2 different sizes here. We actually have 6 different sizes in this container. The most common is our 30-inch high one. This is 23 gallons with our regular waste watcher. And then we have our waste watcher Excel, which is 32 gallons. Now this system I have right now is on a dolly, but you can see that you can interchange the same height, the regular and the Excel all together. Now these units have our restrictive openings for our lids. So you can see this one here is our large waste opening. We also have the lift lid and the mixed opening. Some people refer that as the Saturn or as a circle with a slot in between there. The lift lid here is typically used for organics, but it just stays up like that and you can close it down. We also, as you can see, have the different colors available. And the bodies are stocked in both gray and the colors you can see here as well. The other sizes we have do go shorter, not wider than this. This is how we do this here. And we have our sign frames, which are affixed to the back of the unit. Again, you can get our custom signage in these if you don't like the stocked ones. And you can have the coloring match your stream as well.
Every color that we manufacture is made out of a minimum of 35% recycled content. And as Rebecca mentioned, these are connected through dollies, but you can actually connect the bins together by the top. So if you choose not to have a dolly system, you just want to have it as a centralized standing alone station, you can connect the bins together with clips that we offer, which helps to create a station so that one bin doesn't go missing. It's a very, very popular program. We've done some case studies, as Alec mentioned. He's done a few blogs with correct signage and behaviors behind that and the science behind that. And we've definitely done some case studies on the proper signage of what works, what doesn't, with the back sign frames here. So again, as an option that's very clear and concise, and really focuses on the behavior behind recycling and, getting away from that lazy throw and pointing out the different streams and helping diversion rates, this is one to go with.
Yeah, it is one of our most popular systems as well.
Now, we have been working with a lot of different materials, whether it be plastic, recycled lumber, metal, melamine, and stainless steel as well. So a lot of the products that we work with in the hospitals and healthcare in a centralized area is with metal. Just some of the different fire ratings or fire standards that they have. Many choose to go with a metal container and a metal bin. So we have brought a few of those here, one behind us that we also have on casters because this is carpet and it's very easy for us to showcase.
Plus we're weak, so. Did you want to start?
No,
with
go
this
ahead.
one? Okay, so this is our summit. We actually have this series in about 3 or 4 different containers. We have a front opening as well as an Excel version. But this here is our top lid opening. We have custom signage on the front here, so you can see how talented our graphics team is, and basically add on just some extra signage there for the units so that people know exactly where to throw. You can tell here that the lids are different colors and they just lift open like that for changing, and the liner inside hooks on the side and can be easily changed with the bag out, so nobody has to bend over to lift anything out there.
This is a 15-gallon capacity per liner. Again, as Rebecca mentioned, we do make Excel versions, and we make Excel versions in almost every series that we have. We recognize the need for space. Some areas are higher traffic than others. Others you're restricted by the footprint that you can actually, space that you have to work with to put the bins. So again, this is the smaller regular 15 gallons per stream. As she mentioned, the lid itself, I'm sorry if that was super loud, you can change easily just the stream that's needed to be changed. So if you have a higher area where you've got a waste collection or recycling that tends to fill up faster, you can just simply pull out that liner only and just change out that area. You might have compost that's not collected as frequently, and that might stay a little bit longer. Trying to think.
We do stock this unit in both the triple, as you see here, and we have it in a double as well.
Good. All right, so moving along, just speaking of metal, I hope you can see behind us. This is our, you can see two of the bins. I'm going to move this over. Oh, we'll move the camera over. Perfect. Thanks, Marissa.
Thanks, Marissa.
Okay, so this is our Spectrum series. Again, along with our Waste Watcher, this is probably one of our most popular lines. It is the next step up just because it is made with powder-coated outdoor grade metal. We also carry this in 6 different sizes, anywhere from an 8-gallon all the way up to a 32-gallon. We don't have all the sizes here. These are 2 10-gallon slim units, and then this is a 24-gallon in the middle. We also offer different shapes, so whether it be if you prefer a rounded looking unit on either end, some people think that that's a higher end look and then we'll go with that. The important thing to note here is, again, the additional signage on the back. We can't stress enough in terms of education behind your program and really getting people involved and buying into it. And that's where these additional sign frames and the signage comes into play.
We do stock these units in a variety of different colors. You can see here we have the green, black, and blue. We also stock it in a gray and a white. And the lids, just like the Waste Watcher series, we do have the restrictive openings on here as well. So this is the waste opening, and the one in front of Michelle, she has a circle. So there's lots of different options for that as well. So you have not only the color to promote what you're collecting in that stream, but the restrictive opening, the signage, and the labels on the front here. These are just the icon labels, and we find that very helpful. Again, with our talented graphics team, you can also get custom labels put down the front to clearly display what you're collecting in that stream as well.
Now, since the beginning of COVID, we have developed a new lid for this line as well. It's our antimicrobial lid, which actually helps fight off bacteria, 99% of bacteria within 2 hours. It is sprayed with a copper coating. I can see one over there, but I'm not gonna, no, it's okay. Basically, it's the same as what you see here, but it is slightly a different color as it is sprayed with a copper coating and just instantly helps with bacteria and getting rid of that for COVID. One thing that we didn't mention as well is the plastic liners inside. So regardless of the size that you choose on this line, they do have liners inside that you can neatly tuck your bag and put it in with the corners here. It's very easy for your custodial staff to grab and dump as well and clean inside. And again, keeping your bags neat and tidy so that they're not hanging over the bin itself.
I thought we could just pause for a minute. Does anybody have any questions about particular products or anything that we've talked about so far? No, we can just put it in the chat there.
Yeah, we haven't had anything come through yet. You guys are doing a great job explaining everything, but yeah, keep going. I'll let you know if we have any questions come through. If not, I can always pop in a few of my own questions for you to answer at the end.
Perfect. Thanks, Rebecca.
No problem.
And we do have quite the lineup of containers. Obviously, this is a small showcase room, so we really can't bring all of our indoor, outdoor products with us, all of our extra safe products as well. We've designed a full catalog that are geared towards, it's our Thrive line. Again, with creating a safe space for your employees, your guests, your customers, you know, anyone using that space. And with that said, I'm just going to bring over the extra safe as we talked about this, which is a hands-free foot pedal pump for your sanitization. I'm hoping you can see it. I'm not sure. This one here has a wrap on it, so you're able to add on your signage here. So if you want to have additional signage, if you want to have additional, you know, yeah, just put that on there. You can put your logo nicely as well. It's a metal heavy duty unit, so you're not going to get anything with it tipping over. Also, the gallon size, you think I would know that off the top of my head, but I don't. So feel free if you have any questions about that to type it in the chat. We'd be happy to get back to you. Rebecca and I actually do focus in on the healthcare industry. So feel free, I know Rebecca will, the other Rebecca will put our emails into the chat as well. Feel free to reach out to us directly if you have any questions about products, any concerns. We'd love to hear from you. We're always looking and learning from our end users as well. And we're taking that information back to our R&D department on how and what we can do better to help improve your program, whether it be through you know, your green team and additional education or products themselves and helping them to meet the needs of your program a little bit better. Oh, and I see that Rebecca put that on the gallon size, so that's great. Thank you so much for that. Yes.
Okay, I wheeled over the Aristotle for us as well. So here is another product, and I'm hitting the rise with my back. Sorry, you can just stay like this. We're fine. This is a Melanie product, and again, it is the 15 gallons liners, just like we showed you in the summit, and it just lifts out like that and hooks on the edge, and that's the 15 gallon for each stream that that you can use there. Now you will notice also the lid is just one piece instead of singular like the summit had that we've shown. This one we do have the restrictive openings on it, and you also have a choice to get all full openings as well. The Aristotle comes in a single, double, triple, and in an XL version as well. We also have different finishes on the front, and we have a catalog. I'm sure that Rebecca has put it on there for you to link on to see all the different finishes as well to make sure it matches with your decor. We have added a sign frame to this because, again, we recognize that signage does really help with maintaining your waste diversion, and you can really put whatever signage you want in there.
The sign frame can be added actually in most of our containers, all of our containers, after the fact as well. So if it's something that you already have in place, but you're struggling with diversion rates, or you're looking for that additional feature, then it's something that can always be added on after the fact. You can purchase these and put them on along with the Aristotle, the Spectrum, the Waste Watcher, and even the Rise as well. The sign frame piece is a separate piece, so it can go on the wall actually for any container, not just this one, but it's purchased separately. So if you're struggling and you have a unit that you're already using, maybe it's one of ours, maybe it's not, but you're looking for that signage and something that can be easily changed out, this is a perfect option because it is quite clear, it's low profile, and still gets that message across.
The Aristotle also, I forgot, it does have the casters option available as well, which really helps, as you can see, for us if you need to wheel it around for presentations, or if you're having a function, which is really what it's mostly used for, not for presentations. And that is the casters are available for all of the sizes as well.
And we didn't bring any outdoor containers with us today. We have them behind us, but they're really difficult and heavy duty to bring out. But we have a full line of products that are just meant for outdoor containers to match your indoor program as well. And we work with anything, as I mentioned, from recycled plastic to recycled lumber, metal for our outdoor units also. And we do have all the paperwork. I know it's really important from a sustainability standpoint to know what's going into the materials of the bins that you're purchasing. And we really do take pride in that and focus in on how we're able to make that as recyclable and environmentally friendly as possible. So that's sort of key there. I know we're headed out to almost the 2 o'clock point, and I know there's no questions at this moment. I don't know if anybody that's still out there, if there's any products that they would like to see, whether it be smaller containers. We've got a few here if you want us to grab anything that might be geared towards more of the prevent and protect line with sanitization holders. We've got some of those here as well, which are you know, an excellent choice. Or again, the outdoor, anything else that we can sort of talk about that maybe we haven't touched on that you would like to us to bring up.
Another option would be is Michelle and I are always available. If you wanted to look at a particular product, please don't hesitate to reach out with us. Rebecca's put our contact information in the chat there, and we can always arrange a Zoom meeting where Michelle and I are in this room and maybe do a more in-depth look at a particular product that you may be looking for.
Yeah. Thanks, ladies. I don't think we have too many questions. You guys did a great job. We have, I think most of the questions were answered. One thing I was going to touch on, we have great examples showing the signage there. And we touched just in words on customization, but also I know when setting up a program, it's also very handy. Sometimes labels can be completely customized. And I know we do them a lot where you do have, you know, a sign that says mixed recyclables, but you can also get a label to go on the front of that, a waste watcher, for example, and that can be customized and tailored to what you collect in your specific program. So that can be listed, the certain items that you're looking to collect. So, and I know then on the Rise as well, there we have certain front areas that are great spots for labels. And again, that would be slightly separate from the signage at the back. So basically, any color, anything branded, stuff like that, anything that needs to fall in line with a certain organization, we can certainly do. And that was the only thing that sort of came off the top of my head. But I think we're coming up to that 2:00 mark. And I know anybody that's sort of still here probably has to get going. So I do want to say thank you to everyone who did stay. This will be also part of the recording, of course. So we will post those resources and everything in the next couple of days on our website. And we do usually try to send that an email out to everyone to let them know when that is available. You'll find the links that we posted throughout in the chat as well will be available on the resources. And of course, any product information, find on our website, or please reach out to the other Rebecca there and Michelle. And you can also find contact forms and things on our website, of course. So lots of ways to reach out. And yeah, if you think of anything in the next little while, just give us a shout. And again, thank you all for sticking around. And we will hopefully see you on the next webinar, which we have scheduled coming up in January.
Rebecca, I'm just going to point out one quick thing, and that is the fact that it's important to note we are on several cooperatives and contracts. So please don't hesitate to reach out to us to see if you qualify for any of those additional contract pricing. If you're already a member and you didn't know it, we've really focused in on that in the last year or two. It's just adding contracts in different states and different verticals as well. So there is a good possibility that you could fall under that umbrella and really take advantage of that contract pricing. So it's important to note.
Yes, definitely. Thank you so much. All right. Thank you, ladies. And thank you, everybody. And we'll hopefully see you all in January as well. Thanks so much. Have a great day.
Thank you. Have a wonderful day.